How do I choose a biller and what are some things that they can do for me? So if you're an insurance-based practice and you are either a solo practitioner or group practitioner and you've realized, wow, yes, I do need some help around this, then it's really important to have a biller. I've had a biller basically since the beginning of my practice because I accepted insurance and I'm just the kind of person who I like to have help and support. It's just my nature. Like to do a lot of things. So having help is really important, but having a biller can really keep you organized. And that's probably one of the best things that you can utilize your biller for is to keep you organized and make sure that all the claims that need to be submitted are submitted and that they're paid. With platforms like TherapyNotes, it's really easy to submit billing, especially for the major payers like Blue Cross Blue Shield, United, Humana, Cigna. We use TherapyNotes to submit those claims. It's really easy. It's like one click of a button. We've registered everything. Really smooth, really simple. The problem is when those claims get denied or when they're just not paid for some reason. There's, all kinds of reasons that happen. So having a biller, maybe you don't need somebody to submit claims for you, but maybe you need somebody to follow up on troublesome or irksome claims. A biller can also check benefits for you. That's very common. Usually around the going cost for a biller is 6 to 8% of any claims they submit and anything that they collect on. And then it depends on how their structure is. Sometimes they'll include the cost of checking benefits or they'll charge a separate rate for checking benefits for you. And so again, your electronic health record like TherapyNotes, you can view out eligibility straight from there. But sometimes, people have funny policies. They have large deductibles. You just want to double check on these things. Having a biller can help you sort through that. Another thing a biller can do is if people have outstanding balances, like sometimes we think that people have a $10 copay and they really have a $25 copay and you've seen them 4 times and now they owe $60 and maybe they haven't come back for a session. Your biller can call, send follow-up letters, send links for payments, and really make sure that your practice is getting paid. When you accept insurance, you want to make sure that you are collecting on all of the claims that you submit and making sure you're collecting all of your copays. You want to get paid. So one thing to consider is HIPAA. You want to make sure that you do have a contract with whoever you do decide to hire for billing, and that in that contract there's HIPAA is discussed there, and then making sure that the biller or the company that you use has HIPAA standards in place and potentially having taken a course around HIPAA. So you can really ensure that they're going to be looking at a lot of PHI. They're going to have a lot of access to your client records, and you want to make sure that they are really going to help, your practice run in the most ethical way. So I have one more tip for you, but first I want to thank our sponsor, TherapyNotes. If you're looking for an electronic health record that can really help you bill and really help you keep on top of your practice, I want you to check out TherapyNotes. You can bill directly from there, take payments from there. You can review all of your outstanding claims. They have wonderful reports to help you really run your private pay or insurance-based practice. So I want you to check out TherapyNotes. So the other thing that you want to look at when you're looking at a biller is what level of communication are they going to have with you? Are they going to send you reports monthly? Are they going to send you reports quarterly? Do you have access to them? How often are you able to send over, outstanding claims to them? What is the system going to look like? Those are really important questions to ask during your interview with a biller. I do recommend that you interview 1 or 2, 3 companies or people, making sure that you have a competitive rate, that they can provide you with what you need, and that they're really going to communicate with you on a regular basis. That's the biggest thing about accepting insurance, is just having systems in place and communication in place so that you can ensure that you're getting paid. I'm here most days answering your questions. I'll see you soon, everybody. Bye.